Thanks a lot for taking my question. Dr. Ryan said that the Latin America has not yet reached the peak. I would like to ask him, to ask you, Dr. Ryan, could you comment specifically about Brazil? How far is Brazil to reach the peak? Some say July, August. Do you have something in mind?
Again, thank you for the question, but it's very difficult to predict peaks. If you look across Europe, you look across the rest of the world, you look across the Americas, the peak has an awful lot to do with what you do. What you do affects the peak. It affects the height of the peak, it affects the length of the peak, and it affects the trajectory downwards. That is everything to do with the government's intervention to respond, the community's cooperation with that intervention, and the healthcare and public healthcare system's capacity to act. The virus doesn't act alone. The virus exploits weak surveillance. The virus exploits weak health systems. The virus exploits poor governance. The virus exploits a lack of education and a lack of empowerment of communities. Those are the things we need to address. If we address those things systematically, the numbers will go down. That is what's happened. That is the reality of this pandemic. The numbers respond to response. And there are no magic answers. There are no spells here. You can't divine this away. We have to act at every level. We have to use the resources at our disposal. And we know from many, many country examples, not from WHO, just look around the world, look at the countries that have taken action, look at the countries that have contained and controlled this disease. And you'll find your answers.
I just want to add that, again, fully endorse with Mike has just said, that transmission is completely in our hands, and it's not only in our individual hands, but what we do as individuals to prevent ourselves from getting infected, to prevent our families, our communities, our populations. And we have outlined steps that need to be taken at each level of transmission. We've just published an update of this guidance today, which is focused on critical preparedness, readiness, and response actions based on if you are in a situation of no cases, either you haven't had cases yet or you've actually brought those cases down to zero, where you have sporadic cases, where you have clusters of cases, where you have community transmission. And in this document, it outlines actions, detailed actions that need to be taken for everything from your emergency response mechanisms, risk communication, surveillance, IPC, clinical care, public health measures. And there's a link to every additional guidance that WHO and our partners have put out. And it's the closest thing we have to an actual action checklist that's online. And it just to highlight that there are so many things that we can do, and we need to highlight this. We have tools right now in our toolbox right now to be able to suppress transmission. And so it relates to your question about the peak. We get a lot of questions about the peak in this country or that country or globally. The one thing we shouldn't do is predict, because we need to do everything we can do to suppress this transmission and make any of these predictions that have come out from these models not be a reality. So I encourage you to find this on our site, and we can send it to the list. But this is the closest thing we have to an actual checklist of what you need to do, what all countries need to do to suppress transmission and to save lives.
Thank you. Next question is from Health Policy Watch. We have Gracie with us.